What is diverticular bleeding and how is it stopped? Imagine a tiny pocket forming in your colon wall, kind of like a small balloon. That's what a diverticulum is. When these pockets develop, it's called diverticulosis. Sometimes, a blood vessel inside one of these pockets can rupture, leading to bleeding. That's what we call diverticular bleeding. It often happens suddenly and without warning. You might notice bright red blood in your stool or dark clots. The good news is, most of the time, this bleeding stops on its own without causing pain or other symptoms. Diverticular bleeding occurs because of increased pressure inside the colon. Factors like a low-fiber diet, constipation, and aging make the colon wall weaker over time. As pressure builds up, the blood vessels near the diverticula get stressed and can rupture. When a blood vessel breaks, blood escapes into the colon, leading to bleeding. The bleeding can be quite heavy but usually resolves without needing immediate treatment. In cases where bleeding is heavy or doesn't stop, doctors may need to step in. They often use a procedure called colonoscopy, where a flexible tube with a camera is inserted into the colon. During this procedure, they can identify the bleeding vessel and treat it. Treatment options include injecting medication directly into the bleeding site to stop the flow or placing tiny elastic bands around the vessel to cut off blood supply. If these methods don't work, surgery might be necessary to remove the part of the colon that's bleeding. It's important to remember that diverticular bleeding is different from diverticulitis, which involves infection and inflammation, causing abdominal pain and fever. While both conditions come from diverticulosis, bleeding usually causes no pain and is mainly a vascular issue. Both conditions share risk factors like a low-fiber diet and increased colonic pressure, but their treatments differ. To help prevent diverticular bleeding, maintaining a high-fiber diet is key. Fiber helps keep stool soft and reduces pressure inside the colon. Managing constipation and staying hydrated can also lower the risk. If you notice rectal bleeding, it's essential to see a healthcare professional promptly. They can evaluate the cause and recommend appropriate treatment. Remember, each person's situation is unique, so personalized medical advice is always best.